Virginia Commonwealth University is located in Richmond, the capital of the Commonwealth of Virginia. Richmond has a diverse population of 230,000 people in the city proper and 1.2 million in the Richmond metropolitan area. Richmond is at the fall line of the James River, approximately 100 miles south of Washington, D.C., 100 miles west of Virginia Beach, and 100 miles east of the Blue Ridge Mountains and the Shenandoah National Park. Richmond's revitalized downtown includes the Canal Walk and numerous performing arts centers. It is home to many amazing museums, including the Virginia Historical Society, Virginia Museum of Fine Arts, the Science Museum, among many others. It is also home to the ballet, the symphony, and the opera. Anyone from Richmond will tell you that Richmond is known for its food scene, breweries, and distilleries. At the heart of downtown Richmond is VCU Medical Center, previously known as the Medical College of Virginia. Given our central location, we have a very large catchment area drawing from the entirety of the state and surrounding states. VCU is known for its diverse pathology, encountered both in the inpatient and outpatient settings. VCU Medical Center has 865 adult licensed beds. The VCU Children's Hospital of Richmond is also located downtown with the new Children's Hospital currently under construction. The neurology clinics downtown are currently housed in the Ambulatory Care Center, but they will expand to the VCU Health Adult Outpatient Pavilion, which is also currently under construction. There is a very large neurology presence at the Neuroscience Orthopedics and Wellness, or NOW Center, west of downtown. This houses clinic space, the multidisciplinary MDA and ALS clinics, and its own infusion center.
Hi, I'm Gordon Smith. I'm professor and chair of neurology here at VCU and a proud member of our neuromuscular team. And in thinking about what I find particularly exciting or fulfilling about working here, I'm reminded that there really are three things that drive our satisfaction in the workplace. The first is feeling like we're part of a winning team, that we're champions and doing great things. But more important than that, we need to feel like we're part of a noble cause. And then lastly, we need to have fun doing it. And I think we have all of those here. But it all begins with the team. We have an outstanding team of neuromuscular faculty, 8 core faculty who've trained at some of the best programs in the world, including the Brigham, Hopkins, Michigan, Rochester, and others. But more importantly, this group works as a team. They're very mutually supportive of one another. We work well together, and we're very passionate about our education mission and supporting students, residents, and particularly our neuromuscular medicine fellows. And we share a noble purpose of bettering the lives of patients with neuromuscular disorders, and in particular, trying to discover new treatments or cures for these problems. And we approach this through a large and robust research program that is well funded by NIH and major foundations. We lead multiple national and international clinical trials and consortia, and clearly it's important for our fellows and residents to participate in this mission to learn how they can carry the torch going forward. Another part of our noble purpose really is serving our community, and we do this, of course, by providing outstanding patient care to an incredibly diverse group of patients who have very complex neuromuscular problems, but we do it also through leadership and national and international leadership in our organizations. And many of our faculty have leadership roles in the American Academy of Neurology, the AANEM, Muscle Study Group, Peripheral Nerve Society, and others, which is not only fulfilling, but it really drives our impact, which is part of our noble purpose. And lastly, we're having a great time doing it. It's a fun and exciting place to work. We have a large and growing department. I think we're the most exciting part of that department, but I'm biased. We have many other amazing teams working together. We're well resourced. We're building new facilities. And so if you're interested in joining a very exciting, vibrant neuromuscular community, participating in our noble purpose, and being part of a winning team, we hope to see you here in Richmond, and would very much like to see you come join us here at VCU.
My name is Hini. I'm one of the neuromuscular faculty here at VCU. I am board certified for neuromuscular medicine and elective diagnostic testing. I see outpatient neuromuscular patients and routinely staff the EMG lab. On Friday morning, I work with a fellow during their neuromuscular fellow continuity clinic rotation. About a quarter of my time, I also do EMG-guided chemodenervation for a variety of conditions such as cervical dystonia, limb dystonia, spasticity from MS, stroke, or upper motor neuron predominant neuromuscular conditions. I think VCU is a great place to get neuromuscular fellowship training. It offers a wide variety of pathology, and the faculties here are capable of providing you with in-depth training in almost all those sub-areas. I'm looking forward to working with you.
Hi, my name is Nick Johnson. I'm Vice Chair of Research, Director of the MDA Clinic and the Muscular Dystrophy Translational Research Program. I'm excited you're thinking about VCU for your neuromuscular fellowship because I think we've got a lot of great opportunities for you to provide you all the training you need for your future career. With me, you'd be interacting in a few different ways. Number one, you'll be attending the MDA clinic, which occurs on Tuesday morning. This clinic has a true multidisciplinary clinic with all the therapy services, genetic counseling, social work, nurse navigation, and beyond. And we see great patients from all over the Mid-Atlantic, up and down the Eastern Seaboard, and beyond with a variety of genetic nerve and muscle disorders. I'm also excited about that clinic because many of those patients will be participating in a number of precision therapy trials that will be starting probably over the course of your fellowship actually as the leading center of research across muscular dystrophies. Beyond that, we would be interacting during your neuromuscular pathology service time. I am UCNS board certified in neuromuscular pathology, and you would be assisting me in interpreting nerve and muscle biopsies. I think this is a pretty unique part of our fellowship, and I'm excited that you'd be able to participate in that, as well as our neuromuscular pathology conference, which occurs once a month in conjunction with our neuropathologist, Dr. Richard. With all that, lots of great opportunities. Thanks for thinking about VCU, and I hope we see you soon.
Hi, I'm Dr. Amy Harper. I'm a pediatric neurologist and neuromuscular specialist. I am the director of the Pediatric Neuromuscular Clinic, and I see patients both with muscular dystrophy and nerve problems, both in the clinic and in our comprehensive neuromuscular clinic, where we see patients with Duchenne's muscular dystrophy and spinal muscular atrophy as well. I incorporate our neuromuscular fellows into our neuromuscular clinic for their multidisciplinary education, so they know how to care for all aspects of those children.
Hi, I'm Kelly Guthrie. I'm the Division Chair of the Neuromuscular Division at VCU. I'm also the Program Director of the Neuromuscular Medicine Fellowship Program. I was fortunate enough to join VCU in early 2019 to help grow the training programs and contribute to clinical research. Our division has 6 adult neuromuscular faculty, 2 pediatric neuromuscular faculty, and a neuromuscular nurse practitioner. We have a bustling weekly MDA and ALS clinic with 10 core team members as well. We were fortunate enough in the last year to be approved to expand our neuromuscular medicine fellowship to 2 positions per year. So what would your life look like as a fellow at VCU? So every day of the week you rotate with a different attending. On Mondays, Wednesdays, and Thursdays, you rotate through the attending academic clinics. So you go with the attending in the morning to their clinic, and then you join them in the EMG lab in the afternoon. On Tuesdays, you are in the multidisciplinary MDA clinic in the morning and the multidisciplinary ALS clinic in the afternoon. Our ALS clinic is supported both by the Muscular Dystrophy Association and the ALS Association. On Fridays, you have your own longitudinal continuity clinic in the mornings. There are additional clinic opportunities that you will rotate through as a fellow at VCU. These include the Multidisciplinary Sarcoidosis Clinic, the Pediatric Multidisciplinary Clinic, and the Pediatric EMG Lab. In terms of procedural experience, our neuromuscular fellows have on average 3 half-days of EMG per week. They have ample exposure to single fiber EMG, repetitive nerve stimulation testing, blink reflexes, exercise testing, and other less utilized nerve conduction studies. Our fellows also triage inpatient EMG requests, and they average about 1 to 3 per week, and they also participate in inpatient neuromuscular consultations. Our fellows also have the opportunity to learn muscle biopsy, chemodenervation for spasticity, and participate in skin biopsies. In terms of didactics, the fellows have a very rich didactics experience. Every week I meet with them for half an hour to 60 minutes to review assigned readings and podcasts. This is in addition to the core 21 neuromuscular lectures that are provided every year for the residents and the fellows. Additionally, the fellows will participate in these by giving 1 to 2 lectures per year. We have a monthly EMG and Interesting Case Conference, as well as a monthly Neuromuscular Pathology Conference. Journal clubs occur throughout the fellowship as well, and all VCU neurology trainees are expected to participate in grand rounds on Fridays at noon. With regards to research, the fellows are encouraged and expected to participate in research as acting sub-investigators on clinical trials. Also, our fellows are expected and encouraged to participate in their own research project, which we will mentor them in during the duration of their fellowship training with us. So in summary, the VCU Neuromuscular Medicine Fellowship provides exposure to a wide range of neuromuscular disorders, varied pediatric and adult neuromuscular clinics, and electrodiagnostic training. Our internationally renowned faculty, expansive facilities, and diverse pathology provide the necessary learning environment to prepare any trainee for a successful career in neuromuscular medicine. Thank you so much for your time, and if you have any questions, please do not hesitate to contact me.